Good evening, ladies. How's everyone tonight? Welcome to Wellness Wednesday once again. I know we took last week off after the masterclass, and glad to be back with you this evening. So excited to share what I have to share tonight. We're going to start with the disclaimer, though. We've Anything that I say tonight during this Wellness Wednesday is health information and not health advice. Do not start taking or stop taking or change the way you're taking any of your medications. If you feel like you need to do that, please first consult with your prescribing practitioner so that they can help you make those appropriate adjustments. And by attending tonight's Wellness Wednesday, this does not establish a doctor-patient relationship. Just making sure that everybody can hear me and see me okay. I think we're on just fine, but always like to make sure of that. So thumbs up if you are able to see and hear okay. Just 1 second. Okay, good. All right, so stress. I'm going to hop into this topic right away. The first thing we need to talk about are the different types of stress. And I'm going to try to simplify this. We could certainly maybe think of other ways to classify this, but the types of stress that there really are chemical stress, physical stress, emotional, mental stress. So let's talk a little bit about each of those. So chemical stress, anything in our environment, anything that we eat or drink that can be a stress to our system, our physiologic system, would be considered a chemical stress. So this could be preservatives in processed foods. This could be eating too much of the wrong foods. The wrong foods would be a stress. You could even say eating healthy foods may even stress you out. Okay. Those of you who know you have food sensitivities, these foods literally are stressors for your body, and this would be known as a chemical stress. Certainly, the word gives it away. Anything chemical out there in our environment that exerts some sort of unhealthy influence on our body, that would be considered a stress. So, I mean, the possibilities are almost endless, right, for chemical stressors. We've heard of things like parabens and xenoestrogens, BPA, things like this. These are all types of chemical stress on our bodies. What about physical stress? Anything that happens to our bodies to bump and bruise it and injure it, or surgeries that cut into it, all of these different physical stressors. Okay. Well, of course, I missed back to chemical medications. Okay. Medications would be considered chemical stressors. Okay. Back to physical. I was thinking about anesthesia and surgery, and certainly the anesthesia medications that they use to help you have the surgery would be a chemical stressor. So physical stress, like I said, injuries, even too much exercise. And I know for some of you, when I gave the class, and if you watch the bonus sessions, the bonus videos, I talked about exercise and how sometimes exercise can even be a physical stress. Okay, and then emotional or mental. And I think this is the one that you're most familiar with, that you, at least what you associate most with stress in general is, what's stressing you out emotionally or mentally. And I don't think I need to go in to list those things elaborately, but certainly that's what I think most of us are most familiar with, uh, as far as stress in general and what that really means to us. So when we say, we're super stressed out, or we have a lot of stress, generally we are referring to that emotional or mental stress from a busy job, or um, having to meet a lot of tight deadlines, and those types of stressors, right? Could be that it's relationship stress that is bothering you, or um, stress from your kids. There, if you've got small or younger kids, they're always tugging at you, always um, getting your attention. If they're a little older, well, they still kind of do that sometimes, and they're always asking for help with something, or they need something. There's always these types of stress. All right. Okay. Well, I think we can agree that there is also um, good stress and bad stress. And I want to kind of go through this because I think it's an important distinction to make. Stress isn't all bad, right? Stress is not all bad, because we really should talk about another stress: um, challenge, friction, um, opposition. This is stress in a way too, because and in a way we actually need to have this type of stress in order to accomplish certain things. So think about this on a bell curve. So we start and we go up the bell curve, and we get to the top of this bell curve, right? And this is all stress that's helpful for us. So good stress helps us to grow. You have to have gravity, for example. On this planet, we grow because there's gravity, and we're able to push against it. It allows us to progress. Stress allows us to progress. If there was no friction between your car tires and the street that you're driving on, you wouldn't go anywhere. You wouldn't make forward progress. So um, there's always some needed, uh, friction or stress to push against and to move forward. Stress provides structure. All right, it is absolutely necessary to have, structure. Our bones, if we're going to talk about the body, have to have stress to continue to maintain their density. All right. And that stress is provided by movement and muscle, working our muscles. And so they're always needing that stress to, um, to maintain their density. So think about this. Good stress allows us to grow, progress, to have structure, right? Bad stress, on the other hand, causes breakdown, degeneration, entropy. There's a word for you. Entropy is the dissolution of structure into chaos, order into chaos. Okay, that's entropy, and so bad stress causes that. All right, so here we're at the top of the bell curve, right? And we cross that center median line, and we get into distress or bad stress, and that's when things literally can go downhill, and you're breaking down, you're degenerating, not healing. So it's interesting. Healing requires some stress, but it also will be hampered by too much stress, right? So these are some ways to think about your relationship with stress. And that's really, really important. Let's talk about another way you can look at stress and in relation to your health concerns, your health issues. For many of you, it seemed that your health issues just kind of came on all of a sudden. I'm not saying for all of you, for many though, that it just seemed like, maybe just within a short time, you had more and more of these symptoms. The weight started coming on really rapidly after, in just a short time, or you started having more fatigue in just a short time, or you noticed brain dysfunction, brain fog after just over a short amount of time. Now, I know many of you have had these issues for so long that you can't even remember the last time you felt well. And I understand that. You had stress too, but your body handled it differently. And maybe we can talk about that in terms of, maybe it started to affect you right away instead of filling this bucket slowly and slowly until, for many of you, that bucket filled to the brim, and finally something happened. Another stress was added, and there was like a sudden overflowing event. And it just seemed that these came on real suddenly, and you thought it was just, something that happened around that time that caused it. Well, in fact, your bucket had been filling slowly with stressors, chemical, physical, emotional, or mental, this whole time. Some of these stressors we don't have any control over, right? Some of them we do. And uh, but yet sometimes, a lot of the time, we don't even know that we do have control over some of them. And so that's where that's actually, I'll talk about that in just a second. So it's important to have a good understanding of where and the mindset that you need to understand this stress, okay, and what your relationship with it is, and then understanding that there's a difference between this good and bad stress is first and foremost important. But then you need to know and recognize the source of your stress. Excuse me. Um, so this is the other aspect that I think is so important, that you need to have the correct knowledge and of the source of the stress. And so this depends on where you're looking for that, how you come to have the knowledge, this understanding, how you come to understand the source of the stress. Who can help you understand that is so important. So seeking out, the right sort, the right information for the sources of your stress is so important. I think that's why so many of you are in this, are in this group, because you're looking for answers. And this is, this is because you've not been able to find this on your own, or you keep struggling, and you have these stressors, you have stress, and you struggle so much with the symptoms that you're having, that you just need to find answers. And so this is really important to let me just 1 second, to know who to turn to, and what to, what you can actually believe, right? When it comes to figuring this out. And you can ask yourself, is it good or bad stress? Once you have an understanding of the source of this stress for you, what is, is it good or bad stress for you? And then this will better guide your decisions. Okay. Um, it'll better help you to know how to handle the stress too. That's important. And so, all right, well, one way you can get the right knowledge certainly is through testing. So when we're talking about these physical stressors and chemical stressors, well, you need to get the right tests in order to see what those are. All right, and to be able to recognize what they are, because once you know what the stressors are, then you can work to remove them if they're within your control. Correct? So it's sometimes helpful to journal this out, to diagram it out if you want. That's going to be important for some of you, and then you'll be able to better know what you need to look for to find those answers. Okay, so testing is so super important when it comes to figuring out the the physical and chemical stressors, especially the chemical stressors that um, that you're dealing with that you had no idea. And that's where so many of my patients are finding as they do these comprehensive tests. Um, and I know this is, for those of you who attended the masterclass, this is still kind of fresh because a lot of you have ordered testing and you're looking forward to meeting and going over those test results. But this is exactly what will help you figure out what these are. Now, and we can call these stressors, root causes. We can call them triggers that, cause certain things to happen within the body. And this is how we're going to best define them, is by, getting the right tests to identify them. All right. Now I'm going to switch gears just a little bit from that kind of philosophical look at how, stress affects you, and talk about specific stress hormones that our body makes. All right. Um, the adrenal glands make these stress hormones for us. Okay. Uh, we need to know what these are to know how your body deals with stress, whether good or bad. Right. And so cortisol is the first one I'm going to talk about. It's known as the stress hormone, and typically it's seen as a negative kind of thing, right? We talk about cortisol, and it's usually always in a negative sense that we're referring to it. But in fact, cortisol is it has a good side and a bad side. Okay. Uh, it's released in response to physical or emotional or chemical stressors. Um, Emotional stressors such as fear, anxiety, physical stressors like injuries, right? Cortisol helps the body cope with stress by increasing blood sugar levels, by suppressing the immune system, and regulating blood pressure. Okay. This is important, right? Can you think of times when you were anxious, or when you were injured, maybe, or fearful? Let's say when you were fearful, and you had to do something about it, right? You had to somehow respond, either get out of danger, or to protect yourself from further injury, maybe. Um, so the stress response is helpful. All right, now cortisol also helps with metabolism. It helps regulate metabolism by increasing blood sugar levels and breaking down proteins and fats for energy. It is involved in all of that. So we need that to happen, right? We need a certain level of cortisol to help with metabolism. Inflammation control. Cortisol also helps with inflammation control. Okay. It helps suppress the immune response and then reduces swelling and pain. Okay, so it is anti-inflammatory, and so it does help reduce that, that swelling and immune reaction that happens when you are inflamed and get injured. Now, cortisol also helps to regulate blood pressure, and it increases the body's sensitivity to adrenaline. All right, and I'm going to talk about that in a minute because it is one of the other stress hormones. Cortisol helps the sleep-wake, helps to regulate the sleep-wake cycles. All right, so it's released in the morning at higher levels to help you wake up and to help you stay alert, and then it decreases through the day because you're now more alert and you're staying more alert, and then it can drop into nighttime and then be low enough for you to fall asleep well. Cortisol also helps with mood regulation. Okay, so it can affect mood and cognitive function as well. Higher levels of cortisol certainly can lead to anxiety, depression, irritability, but you need certain, balanced levels of cortisol to think properly, to have clarity of thinking, to be able to remember things, to bring things from your memory to the forefront where you need to use that in whatever you're doing. All right. So apart from these positive things, too much cortisol certainly will negatively affect your thyroid health. So let's talk about that for a moment. Too much cortisol will interfere with TSH production, so it'll decrease TSH production. If you recall, TSH is thyroid stimulating hormone, and it comes from the brain. It tells the thyroid to produce more hormone, and cortisol will interfere with that and decrease that TSH. So your thyroid gland won't produce as much hormones either in that case. All right. So it has an effect of too much cortisol will have the effect of causing too little thyroid production and hypothyroidism. It also interferes if it's too high in the liver, it interferes with T4 conversion to T3. Okay. And T3 is the active hormone. And so once again, it will decrease thyroid hormone conversion from T4 to T3. Well, why would it do that? Well, when your brain is trying to keep you alive from all the stress that toxins are causing your cells, your brain says to your cells and all this, what I just described in the pituitary gland and in your liver, stop everything. Let's slow down that effort, right? To increase thyroid hormone, which turns up metabolism, which will make the stress in your cells way too high, in addition to the toxic stress that you're dealing with, and your cells will die otherwise. So this is your body's way to help you slow down and heal, right? Or survive at least survive when there's a lot of toxic stress, which we would then classify toxins as chemical stressors, right? So I hope that makes sense. I hope that makes sense and tells you why a lot of you are so fatigued and tired all the time, because your cortisol production is really high. At least it has been, and now it might be too low. So there's a transition. You go through different phases, and I'll show you that later as I bring up a couple of examples of saliva testing, because I'll share some of those with you a little bit later. All right, the next one we need to talk about, the next stress hormone, is adrenaline. And so how does adrenaline work and what does it do? Well, adrenaline triggers the fight or flight response, and it increases your heart rate and your breathing rate. So it does that to get more oxygen to your cells, right? You're breathing faster and heavier so that you're getting more oxygen to your tissues so that you can either get out of there quick, right? Or turn and fight, right? You're there, you're ready, it's preparing you for that, right? It dilates your air passages to provide, again, your muscles with more oxygen, right? So you're ready to either fight or get the heck out of there, right? So it increases delivery of glucose and oxygen to the brain and muscles as well. So when is this necessary? I'm sure you can think of times when this has been absolutely necessary in your life. I may have shared this before, but I had a run-in with a bull elk one time, and I was just trying to take its picture. And he lunged for me, and I literally jumped over the car next to me to get out of its way. Literally cleared the car, all right, from just a standing position. And so I know how adrenaline works, and it's pretty fascinating. All right. Adrenaline is used in medicine also to treat severe allergies or anaphylaxis. Some of you have heard that term before, closing up of the airways. All right. Um, and so it opens up those airways to prevent you from dying, right? This is also known as epinephrine, okay? Epinephrine or EpiPens in medicine. This is adrenaline. All right, now noradrenaline or norepinephrine is another adrenal hormone. And again, these are all made in the adrenal glands. And these are released, the norepinephrine is also released during stressful situations. And it increases your heart rate, your blood pressure, your breathing rate. It prepares the body for fight or flight, just like adrenaline does. And it helps with arousal of your faculties, right? It helps with focus and alertness, right? I could tell that was what was going on when I dodged that bull elk's antlers. It literally helped me to see my surroundings immediately, and I was able to clear that car. So it improves this aspect to, again, help you flee or stay and fight if necessary. Norepinephrine is also linked to mood regulation. Now, these hormones are very tightly connected. Another one that you've probably heard of is dopamine and GABA. And when these are messed with, even a little bit, you can have imbalances in all of those. But in terms of norepinephrine, too little of it, when it's too low, when you're not able to produce enough norepinephrine, this can cause depression. Okay. And too much of it certainly will lead to anxiety, right? So unfortunately, there's not real great tests for these hormone levels. We do test for cortisol. There is a blood test for it, but it's more accurate to test it in saliva, and so we do that. But as far as having norepinephrine or adrenaline checked, it's really not. There's really not a good test that at least that I know of to test for some of that. There are some urine tests. The Dutch test is a test that might look at breakdown products. Okay, so we call these metabolites because one reason the test isn't great is because these hormones break easily into metabolites. Okay, so they're processed really quick and they turn into other substances that then we can measure in urine tests. And so there are ways to measure the metabolites, but not these hormones in particular. Norepinephrine also releases glucose for ready energy, similar to adrenaline, and it dilates your pupils so that in low light you can see better. Okay. And then norepinephrine is involved in memory formation and retrieval. So think about this. If you lack this hormone, if your adrenals are suffering overall from insufficiency, this is going to result in some pretty significant brain fog and poor memory, even long-term memory, because you won't be able to access those memories without this norepinephrine to retrieve them. All right. You'll likely have lower blood pressure and decreased alertness and focus. So you'll be easily distracted, but more just a real unclarity of or decreased alertness, I think is just the best way to say that. And you might even have apathy, right? So that can go along with the depression. Norepinephrine is used medically to treat shock, right? And some forms of heart failure too. And I've had to use those as working as a hospitalist, so I know all about those. All right, practically speaking, please note that when these hormones are produced a lot, all right, you will have, and you have too much of it, you will have an underproduction in your adrenal glands, underproduction of other hormones. And these other hormones regulate your electrolytes and fluids. So aldosterone is the main one there. And when you lack aldosterone, you will have a wide anion gap, and I've pointed that out as I went through some tests, some blood tests during the class. And this can have a lot of similar symptoms where you'll have heart palpitations, and you'll think that's anxiety. This is exactly what your heart needs to do to bring the blood pressure back up. All right. You will potentially have brain fog just from these electrolytes being imbalanced. So this affects the way your nerves fire. Okay. It can seem that you're sluggish in your movement and reaction to things when your aldosterone is low and your electrolytes are imbalanced. And then this can also cause a decrease in short-term memory. This can lead again to the development of dementia and Alzheimer's. Okay. All right. Now the other hormone that can be underproduced is DHEA. And you need DHEA because it is a repair hormone. It actually helps help your cells in healing. It helps your thyroid to function. It's very important for cells to have enough, for your body to have enough DHEA so that it will help your thyroid to function better. You also need DHEA to balance your hormones, testosterone and estrogen. And if you don't have balance there, you can have all kinds of other symptoms, right? Like low libido, low muscle mass, if you are lacking testosterone. Lacking estrogen can lead to heart failure and Alzheimer's as well, and osteoporosis. Too much estrogen can promote weight gain and mood swings and disorders, poor sleep. So it's all so important to have, to know how these hormones are imbalanced when you're dealing with stress. So knowing about all these different hormones, okay, and this is adrenal dysfunction, when there is over or under production of these stress hormones, right? This is what defines adrenal dysfunction. And let me just add that the main symptoms you would have with underproducing the stress hormones, in other words, adrenal insufficiency, would be lightheadedness, dizziness, low blood pressure, depression, fatigue that is really heavy fatigue, right? It's just like sometimes you feel actually weighed down, brain fog, lack of clarity, poor memory recall, or poor focus in general. Swelling, also swelling can happen with electrolyte imbalance and underproducing these stress hormones as well, because this doesn't just happen, it happens after there's been a period of overproducing. So it's kind of like that bell curve. You'll get up to a point where you're really producing and producing, and then you're overproducing, and then you'll drop down on the other side and start to underproduce them. And that's when things are a little harder to counteract, but it's possible. We just need to recognize that that is what's happening, right? And then we can hopefully stimulate your adrenals, help your thyroid rebalance, because your adrenals very much depend on thyroid hormone to activate those cells, right? To turn on those to turn on those. So I saw a comment from my staff. To activate the metabolism in the cells of the adrenal glands. They need adrenal. The adrenals need thyroid to help. And the overproduction of stress hormones certainly can lead to fatigue and weight gain because of the resulting thyroid dysfunction. Again, cortisol interferes with the thyroid function, as I discussed before. And dysglycemia, which too much cortisol especially will also, I mean, all of these stress hormones will cause dysglycemia if they're overproduced for long enough, okay? And that then promotes insulin resistance. So as far as how this can affect certain things, and I mentioned brain fog would be another symptom of overproducing cortisol and the stress hormone. So this would affect your memory because, again, too much cortisol is going to impact your thyroid function. It's going to decrease TSH, which causes a decrease in thyroid hormone production. And your brain needs thyroid hormone as well to help you remember, especially in the moment. Okay, you need active thyroid hormone to help all of your brain, including the hippocampus, which is the short-term memory area of your brain, which decides what you're going to need to remember short-term and move it into then into working memory and then long-term memory. So lacking thyroid is why we go into that problem of short-term memory, okay? And so it's important as heck to know if you're actually hypothyroid or not. And that's why getting the right test with respect to thyroid is also super, super important. So just briefly, we'll just look at a couple of examples. And we see just a graph here of this gal's cortisol. This one's she's on the low side. So she's past the point, okay? And her DHEA is also low. So she's been through phases of this, and she's past the point where she was producing a lot, earlier on in her, probably her earlier motherhood and, work history, as she went through life working and so forth. Now, this is a gal who we were able to help quite a bit and help her thyroid rebalance. And she went from being very, very fatigued. Obviously, you're going to be fatigued when you have low low cortisol levels like this, and certainly able to lose some weight. And so a lot of the typical result is our patients doing so much better because we are addressing these stressors and addressing the adrenal insufficiency and adrenal dysfunction. So, and then this one shows an example of overproduction during the afternoon, kind of high in the morning, like it's a little too high, probably waking up with a little bit of hypoglycemia, and then it just continues to increase. This will happen when you don't eat breakfast and you do intermittent fasting, which I told for many of you, this is most of you actually with thyroid issues, is not a good thing. And so your cortisol rises. And I just went over what happens when your cortisol rises and it stays high. And then this gal's already just not being able to keep that up, it'll drop. It'll drop. Her adrenals get tired as the day goes on, and she can't sustain that cortisol to help her get through the rest of her day, and she gets really tired in the evening. It's almost like she hits a wall at like 3, 4 o'clock. And there you have it. So these are some examples of what we look at when we're getting the right tests, ladies. All right, so understanding the sources of your stress is super important. And you need to get the right testing in order to better understand the chemical stressors, the imbalances within the body that are stressing the body. And, obviously I've gone long and I don't have time to get into all the, ways to help this, but there is help. And one of the reasons why I brought this up is that I probably will do another Wellness Wednesday on stress management techniques because there are many. The timer in the beginning had some interesting music associated with it. If you heard it, I hopefully was able to play. Sometimes listening to certain frequencies can be very, very helpful in managing stress. Doing meditation, certainly prayer, taking time to be by yourself and journal. These relaxation techniques, all of these are very, very helpful. Breathing techniques, right, are very, very helpful in managing, stress. So again, I've gone long and I won't get into all of that, but it's so important to understand this topic, and I hope this has been helpful for you. I'll pop in tomorrow again to answer some questions. And I hope you all have a wonderful evening. Thanks for joining me for Wellness Wednesday. And remember, please have hope, ladies. There are answers. And I share this with you in order to help you understand and give you some answers that you may be looking for. But remember, always remember, you still have the power to heal. All right, have a nice evening, everyone, and we'll see you soon.